I'm including this lesson on caregiving in the resilience module of the course because people our age can often find ourselves providing support to parents, spouses or partners, grandkids and siblings, and we might find ourselves in the position one day where we need caregivers. If you don't need this module now, I invite you to view it quickly anyway because it can be helpful to know what resources are available if you ever need them. As we talked about when we discussed the implications of longevity, in 2020, the National Alliance on Caregiving and AARP released their list of U.S. caregiving statistics. 53 million people in the U.S. now characterize themselves as caregivers. That's up significantly from 2015. Nearly 1/5 of the U.S. population now cares for a loved one. Becoming a caregiver doesn't mean that you instantly have the skills and know how to assume this role effectively. Caregivers often find themselves playing roles that require becoming educated quickly. Many family caregivers might feel that they are alone in caring for their loved ones. The truth is that there are many services and professionals available to assist if you know where to look. But sometimes the demands are so overwhelming, people don't carve out the time to look for and find the resources that are available, which is one reason that knowing in advance is very helpful. Some caregivers do rely on other people to help them with caregiving duties like support groups, transportation services, community programs, and social services. You might even be able to obtain financial assistance through an employer or the government to ease some of the financial strain. I've outlined a few resources available in the bibliography that's in Module 1, and I update this often. Some typical caregiver issues that can arise include isolation, stress, loss of social life, finding difficulty in asking for or accepting help, maybe even feeling guilty asking for assistance because you view the responsibility as yours alone. You might find as part of caregiving that there are role changes in relationships. Your parent was always the one looking out for you, now you are looking out for them. Or maybe the person who is sick was the one who was always taking care of the finances. Many times the caregiver takes on new additional roles in addition to the medical caregiving roles. You might start out providing support like checking someone's mail or shopping for groceries, and then find yourself progressively spending more and more of your time. Many caregivers live with the care recipient. When Rich's dad, Randall, was being treated for cancer, he lived with us in Ohio and was treated at the James Cancer Center. I was working full-time, so the medical caregiving felt rich, and I supported as I could with errands and planning nutritious meals and making his smoothies and giving some emotional support. Some caregivers provide long-distance caregiving. That's what Rich and I did for several family members, including my sister, Rich's brother, our parents at different times, and I wish I had known about some of these resources because long-distance family caregiving presents some challenges. Many of these same organizations offer advice and guidance for long-distance caregivers, as shown in the bibliography. Some care recipients are more independent than others and can take care of their own daily needs, and others require assistance with everyday tasks like going to the bathroom, getting dressed, eating meals, housework like cooking and cleaning, errands like grocery shopping or picking up medications, medical care including taking prescriptions or attending doctor appointments, decisions about healthcare, finances, legal issues. Some care recipients start off needing a lot of care and then they get better. Others gradually need more care for progressive diseases like Alzheimer's or other forms of dementia. A family caregiver may also need to work or take care of children while balancing their caregiver duties. Family caregivers are also often given the additional responsibility of handling the care recipient's legal, financial, medical, end-of-life needs, and sometimes becomes the decision maker on the care recipient's behalf. Obviously, this can be enormously stressful and intense. Common needs of caregivers include researching, outlining, managing, and understanding treatment options, learning the latest information about the disease, medication, and treatments. It can be overwhelming, like learning a new language, navigating insurance coverage, dealing with claims, trying to understand what's paid and not covered, making appointments for treatment, therapy, specialists, communicating with medical professionals, navigating transitions if the disease progresses, determining the best way to make decisions about the right next step, advice about when the person you're caring for needs more than you can manage alone. Maybe you have heard the term caregiver burden. Caregiver burden is the extent to which caregivers perceive that caregiving has an adverse effect on their own emotional, social, financial, physical, spiritual functioning. It's multidimensional and highly individualized. A set of tasks that might be highly stressful for one person might not be for someone else. This burden is frequently overlooked by healthcare clinicians who are primarily focused on providing treatment for the person with the disease. But I believe that caregiver assessment and interventions should be a part of routine care, and that the better informed you are, the more you will realize that there are resources that can help you in the caregiver situation. Certain types of disease have more fleshed out caregiver support. Certainly, the American Cancer Society has a large number of systems and services and programs in place, but so does the Autism Society, the National Alliance on Mental Illness, the United Cerebral Palsy Association, the ALS Association, the National Multiple Sclerosis Society. Many university hospitals have centers of excellence where they focus on a specific disease. For example, UCLA Health offers a series of videos and webinars designed to help those caregivers of patients with Alzheimer's or other forms of dementia. The resources include topics like depression, home safety, and repetitive questions. There's an American Cancer Society caregiver self-assessment questionnaire you can take, and this type of questionnaire may be available for other diseases as well. Caregiver resource guides are available for most known lines of disease, and the treatment team should be able to point you to these resources. For example, this cancer resource guide. One thing healthcare professionals need to do is incorporate the needs of both the caregiver and the patient, and like everything else, some are better at this than others. It's clear that caregiver needs change throughout the journey, depending on what's going on with the person you provide care for. Paying attention to your own well-being and your feeling of confidence that you're able to meet the needs of the person you're taking care of is vital. It's important to recognize your own needs and how you're coping. Assess and see where you are. Some signs of caregiver burden are feeling exhausted and depleted, feeling guilty for taking time for yourself, resentment, feeling critical, unable to laugh or take situations lightly, feeling trapped, unable to sleep, too overwhelmed for self-care like hobbies and exercise, feeling underappreciated, and anxious or in a low mood state. It's important to pay attention to these red flags and check in and really see what's going on and maybe get some professional help. One big risk factor for caregiver burden is residing in the same home as the person you're taking care of, and that's a big one because there's no break or opportunity to step away. So what helps? Finding ways to reduce stress. Consider what coping strategies have worked for you in stressful situations in the past. The resilience strategies we discuss can help. Often the very first red flag is your own physical health because stress has had an impact on your body and you don't always take care of yourself. Enough sleep, exercise, healthy food, fresh air, taking care of your own medical and dental needs, and practicing stress relief, relaxation, group or social support, meditation, yoga, breathing, muscle relaxation, guided imagery, getting a massage, mindfulness, and focusing on the present, gratitude, and journaling. You can learn and practice effective problem-solving techniques so you cope more effectively and you don't get stuck. Cognitive behavioral therapy, where you examine your thoughts, feelings, and behavior related to stress and worry. Learn to reframe or restructure your thoughts in a healthier way that will help you cope with more resilience. Many major medical centers now offer counseling and support for patients and their families. It's important that you're getting support from family, friends, neighbors, maybe a faith community, and that you find time to engage in the things that you find meaningful and enjoyable. Find some resources and know where to go for help so that you don't get overwhelmed. Who can you pull in to help? Who is good at what? When you're thrust in the role of caregiver, it can also be helpful to examine your own spirituality, which is defined as that aspect of humanity that experiences connection to the moment, to yourself, to others, to nature, and to the sacred, because spiritual support can give you courage and hope and help you see a path to the next right step in a situation. Maybe you're experiencing questions like, why is this happening to me or my loved one? Spirituality can help you grow through the challenging experience. In terms of practical support, an important consideration is understanding who is the entire treatment team. What roles do they play? And this helps you navigate who to reach out to for what. Doctor, surgeon, physician assistant, nurse practitioner, nurses. You might also encounter a patient care resource manager. Depending on the diagnosis and the disease, you might also have access to a dietitian, social workers, clinical pharmacists, rehab professionals who provide specific therapies. There are trained social workers for different major diseases, and their resources can be very helpful as you navigate the journey. They may be a linkage to community resources, helping with transportation or financial needs. If you're having a problem and you're not sure where to go, the social worker can likely help you find a resource. Your medical center may also provide financial counselors and all kinds of patient education. Another practical tip is about getting organized. The more you know, the more you feel in control. Your treatment team should be on the front lines of getting you the right information and give you resources so that you can think about your questions, write them down, and make sure that they all get answered. They can also point you to trusted libraries, librarians, and websites so that you're getting recent, evidence-based information and you're not wasting time and energy surfing the internet and perhaps getting misinformation. Several disease lines have patient navigator phone lines and support that link you to resources and help you address practical needs. It's also important to learn about effective communication to make sure that you talk openly and frequently with the person you're taking care of. This can actually strengthen the bonds between you, and you find that your relationship can actually grow through this challenging time. Communicating clearly can also help you with your treatment team. There are some tips like using I statements. Beginning the statement with I shows you take ownership for your feelings and you're speaking honestly and openly. For example, I feel frustrated when you don't give me updates because it makes me afraid that you're hiding something. Thinking about your communication also helps you know when to talk about difficult topics. You can practice active listening so that you're paraphrasing and checking in to make sure that you really are on the same page. Really think about what you want to communicate and rehearse your message. There are organizational and logistical tools can help you stay on top of medical appointments, medications, test results, insurance bills. The American Cancer Society has a wonderful health manager kit that they will send you. Other disease lines have things like this too. It doesn't matter what organizational system you use, it's just important that you have one. If you are tech savvy, there are a number of apps that you can get that will help you, and they are shown in the resource guide. MyChart is a great tool that most medical centers have, and that helps ease communication burdens. You can form an online community like Lots of Helping Hands or Caring Bridge for the person that you're caring for to enlist help and ease the communication burden on you so that you aren't responding to an inbox full of emails. This engages your support community so that you can post updates, calendars, where you list your needs such as driving to a medical appointment, getting a meal delivered. People want to help, and this gives them specific ways to provide support. As a caregiver, it's important that you talk to the person you're caring for about the things we talk about in Module 8, advanced directives, their wishes, who they want making decisions in the event they can't. Ideally, you fill these forms out when everybody's healthy and clear-minded. Social workers can certainly help with this if you don't have time to get to an estate attorney right now. Remember, your needs matter. It's important to find ways to support yourself. I've also linked a Caregiver Bill of Rights by Joe Horn, which I think is really good. It can serve as a reminder to prioritize your own care and your own well-being. The responsibilities of caregiving can be rewarding but also overwhelming. So if you find yourself in a caregiver role, take care of yourself. This helps you focus on your own well-being so that you can avoid burnout. Getting enough rest, eating a balanced diet, taking breaks when you need them, and asking for help are all important ways to continue to thrive even when you find yourself in a caretaker role.